So our final speakers this afternoon are Dr. Melinda Ellison from the University of Idaho Extension and Dr. Whit Stewart from University of Wyoming Extension. And they will be presenting on nutritional management during lambing and kidding.
Thank you very much. So just to preface, as we move into this talk, Whit and I wanted to just provide some reminders to all of you about nutritional management during kidding and lambing. So of course, this is not going to be all inclusive, and it's probably going to vary a little bit based on your operation and what's going on. Just some things to think about. And I will point you back to some of the other talks that we've done on nutrition last year. So there's a couple that are posted to our YouTube channel, one being a more in-depth talk on small ruminant nutrition, but also some ration balancing that we did with Ward Laboratories, Rebecca Kern. So I'll just preface this talk with that, and we'll move forward with some of the pointers that we wanted to remind you guys as you're going into your late gestation and early lactation periods. Nope. See if I can get it to. So this is the most critical time in my mind for body condition and what weight your animals are at. So this is a reminder of how to make sure that your animals are in the right condition for this time period. And of course, we really want to strive for this throughout the year. But when you go to identify in your animals, especially in sheep, it's important to get your hands on a handful of them and make sure that you really do understand where you're at from a body conditions perspective. So one body condition is approximately a 13% change in body weight. So a 150-pound ewe or doe is going to gain or lose 20 pounds to go up or down a body condition. So if you think about that from the perspective of sheep and goats are very similar body size to humans, like it or not. So if you think about it from putting 20 pounds on your own self, that's what you're looking at for your small ruminants as well. So the primary thing here is when you can feel every single backbone and that transverse process, you don't want to be able to feel every single piece that's in there. So this is a ewe that is way too thin. And even on this lower side of body condition too, you want to have some covering over those. So the other alternative then is if you're feeling your animals and you can barely tell that she has any bones, she's got way too much fat on her. And I understand that this is a small window to try to stay in, but it's very important from a number of perspectives. But it also gives you an idea of where you're at from a nutritional standpoint, if you're overfeeding or underfeeding. And I can assure you that during lambing is not the best time to try to overcome these, because it's going to cost you a lot more money, especially if you're trying to gain weight on these animals, than it would if you just stayed in that good body condition range prior to coming into this period. So this is a chart, and I know for some of you, you've seen this before. It's just something that I like to sort of come back to at the beginning of a talk like this. When you are at the lambing period, your animals are obviously going to be heavier because they're gestating and having fetuses inside them. So at this point in time, when you're going into lambing, you may see that your ewes have lost a little bit of weight, but you don't want them to ever lose more than half a body condition score, which is 10 pounds, while also remembering that there's fetuses in there. So that's going to affect how much she physically weighs. So this is why body condition is so important. So at lambing, you want to have your ewes and does, sorry, lambing and kidding, I apologize. You want your ewes and does to be at that 2.5 to 3 body condition score, because as soon as those lambs drop, she's going to have to start working really hard and using a lot of protein and energy to make milk, right? So this is the time period, like I said, that's the most critical to be at this good body condition. So when you think about if your ewes and does are too fat or too thin, either direction, which Brett talked about earlier in his first talk, Fat can also cause issues with milk production, and thin, she doesn't have enough energy to put into milk production. And so what ends up ultimately happening if she is raising those lambs and kids is they're not going to grow very well. And at that point, they've probably already been stunted because prior to birth, they were also not receiving the nutrients that they needed. So Whit's going to talk a little bit more about pregnancy toxemia and some other things that can happen, but this is where it's too late. So if you're coming into late gestation and you have ewes and does that are too fat or too thin, it's too late. But here's where we can start working towards next season. We need to get them on the right plane of nutrition and move into next season in a better place. So hopefully your animals are in a good place when we're coming into that late gestational period. And one of the things that's really important to note as we move into that late gestation and lactation period is that their requirements are going to increase by quite a little bit. So in a maintenance diet, this is a 160-pound mature ewe, and these are going to be similar for does as well. She's going to need to eat approximately 2.8 pounds a day, whereas she moves into these later gestation and early lactation periods, you can see just from an intake standpoint that she needs to eat more when she's raising lambs or kids. The other thing to note is that if you have yearling ewe lambs or does, they are going to require even that much more intake and nutritional requirements solely because they are growing in addition to also making babies. So just keep in mind that you do need to adjust your dietary offerings to these animals as they move into these periods. So as an example, the two main things that I focus in when I talk to you guys about these things, and of course there's a million other things that we can look at, but the two that I think are the most important to try to target would be crude protein, and then also TDN, which is total digestible nutrients, and that's going to be indicative of the energy that they're receiving from the diet. So as we've talked about in previous webinars, it's super important to get your feeds tested and have a good idea of what nutrition is in those feeds. And that way you can balance a diet that's appropriate for your animals. So another thing to keep in mind though, is that if you feed them something that is short in nutrients, you can't make up for it necessarily by feeding them more. There's only so much room that they have in their ruminants to eat a certain amount of feed every day. So let's have an example here. If we're feeding brome hay, crude protein in this hay is 9.7%. This is kind of a mid-range grass hay. And then you have 55% total digestible nutrients, which again is indicative of the energy they're going to pull from that feed. So let's assume we're going to take the average of our late gestation, or even the high end of our late gestation animals, and we're going to feed 5 pounds per head per day. If we're giving them 5 pounds per head per day of dry matter, that's 5.5 pounds as fed. Remember that feeds have a little bit of water content in them, and that water content is not going to translate into nutrients. So we take that part out. So at 91% of that hay is dry matter that they can gain nutrients from. We feed 5.5 pounds of the hay as a whole. We're going to get about 0.49 pounds of protein per animal out of that feed, and 2.75 pounds of TDN. So in this particular case, all of these animals are going to be getting enough intake, except for if they have 3 or more offspring and they're lactating. We're going to meet protein and energy requirements for these animals that are in late gestation and they have a single lamb or kid or twins. But the rest of these animals are not going to meet their protein and energy requirements. So you can imagine during late gestation and lactation, this is kind of a critical period to be meeting their nutritional needs. Let's also recognize that 5 pounds of feed per day is a little bit higher than what these guys are going to be willing to eat probably. So they're probably not going to get what they need out of it either. And the other thing to take note of is the more offspring that are happening inside an animal during gestation, the more room they're taking up, right? So the question is, are these animals truly going to be able to take in 5 pounds per day if they have 3 lambs or kids in there blocking all the room in the rumen? So let's assume now that we can only get these animals to eat 4.4 pounds of feed per day. And here's our calculation for how much protein and energy they're going to receive from that. And at this point, we're not meeting nutritional needs for anybody. So now you can see that even though this brome hay probably was fine during maintenance and early gestation to meet nutritional requirements, at this point in time, during late gestation and early lactation, we need to be supplementing both energy and protein to make sure they're getting what they need. The other thing to consider is that lambs start feeding on solid feeds at 2 to 3 weeks old. And while they don't take in a lot of feed, if you have a bunch of lambs running around out there, they're going to be eating some of the feed that's meant for the mothers. So you have to account for that as well. So just a quick run through of some of the things that you can supplement with. I'm not going to go through them all. You can look back at this talk when we post it on YouTube, but here's some options if they're available in your area. And certainly it's important to balance this diet and make sure you're not just randomly feeding something that they don't need, or maybe you're not feeding enough of something. And again, if you need help with balancing rations, I'm more than happy. Shoot me an email, especially if you're willing to get your hay tested so that we can get a really good feel for where you're at nutritionally. But here are some other software that are available to you that you can balance rations for yourself if you feel comfortable. Finally, I just want to talk about placement of feed, just keeping in mind that if you're going to feed on the ground, for example, this is an opportunity for a lot of fecal and urine matter to be on the ground and in the hay and leftover waste and all of that, and you're going to have a higher chance of disease spread, especially with the lambs who like to lay in the leftover hay. If you feed in feed bunks, this is a good way to decrease the amount of disease spread and also understand better what the intake that your animals are truly eating every day and having less waste. The other thing to limit animals overfeeding or underfeeding is, of course, avoiding the pecking order. If you have ewes that are extremely fat, they're probably the boss ewes. So they're kicking everybody else out. So making sure that they have enough space and getting that opportunity to eat, even if they're the underdog. Another thing is if it's super cold at night and you're getting a lot of wind and whatever may be going on out there, just give them a little bit of extra so that they can keep up that body temperature. The other thing would be if you feed them twice a day during these time periods, they're able to eat more, especially when you have those twins and triplets on board. And then if at all possible with your operation, split them out by different stages. If you've got ewes with triplets or twins or whatever, feed them separate of the ewes that are raising singles. That can help decrease your feed costs while still maintaining the nutrients that your animals need. I just wanted to touch quickly on water. Make sure that they're getting enough water to make some ewes that are non-dairy ewes can make 1 gallon of milk a day for their offspring. And so they need to have that water. Make sure that you understand your water quality and that your animals are drinking what they should be drinking. And if they're not, you may have something wrong with your water. Maybe a high amount of, sulfur or whatever. So it's best to get that water tested if at all possible for good management. And the other thing to consider is that while we do know that sheep can utilize snow for water, make sure that you understand the quality and availability of that snow. If it's super dry and crusty, they're probably not going to get as much moisture out of it as they need to be to make milk, especially. And I wanted to throw in this milk replacer slide because it's been a topic of conversation a lot this spring, asking whether or not cow's milk is acceptable. I just want to point out for sheep, the fat content in a used milk ranges anywhere from 6 to upwards of 11% fat, whereas a cow is only 2.5 to 4 approximately. So goats range a little bit closer in fat content to cows than sheep do, but I would recommend strongly to feed a milk replacer that is specific to lambs and kids so that you know they're getting enough. And usually the milk replacer has different mixing directions for sheep and goats. And the other thing to point out is that there are differences in the mineral contents of each of these milks. And so in addition to enough nutrients in that milk, you're having a different profile of those minerals, which contribute largely to growth and overall health of these animals. The last thing to think about is getting the lambs and kids on some kind of a creep where the ewes and does can't access it. This will help them get a good start in the beginning, especially with, say, your orphan lambs, any lambs or kids that have trouble in some way from the early part of their life, and if you're going to do some early weaning. So if you provide this feed to them from the very beginning, they have less chance of eating too much and having gut upset, and they start sampling, like I said, within that 2 to 3 week old period, and they'll start to transition onto that feed. And with that, I will pass it on to Whit.
So Melinda did an excellent job talking about the importance of energy and protein as we progress through pregnancy and into lactation, but oftentimes we can forget the role of macro minerals, or those minerals that are required in greater quantities in the body, and the micro minerals. And so I put this together just to show you the dramatic increase from breeding to late gestation. And let's just focus in on calcium for a minute. It's approximately, for this scenario of a 176-pound ewe, it's about a 200% increase for that twin-bearing ewe from breeding to late gestation in her calcium requirements. Now that's significant. For singles, it's about half that, but it's still about 100% increase. And so I think it's really important that we keep in mind and monitor consumption of our minerals. First and foremost, making sure that our minerals are adequate. There's plenty of nutritionists out there, and there's a large body of literature that has aided our ability to make those good decisions. But one of the reasons that we want to make sure that calcium is well covered during the late gestation period is low calcium levels, or the presentation of milk fever. And so as we make sure that that's provided in adequate quantities in gestation early on, and not waiting until the tail end, we can make sure that there's adequate calcium in the diet, and also adequate calcium for that ewe to mobilize it. You know, we'll talk in depth about pregnancy toxemia and milk fever here in a minute. To a lesser extent, magnesium deficiency or hypomagnesia, that's a grass tetany symptom. That's probably more applicable to grazing really lush early spring growth pastures. In the ewe, we don't see problems in the lamb, obviously, in this scenario, but very, very similar increase that we see as we get into different stages of production. And I just wanted to highlight that we cannot overlook calcium requirements and those other macronutrient requirements. I also wanted to point out the difference between those requirements for calcium and those other macro minerals between a mature ewe and a yearling ewe are very different. Melinda alluded to the fact that from a protein and energy standpoint, that yearling ewe is still putting on frame and skeletal growth. And so it's important that we make sure that we provide those. And just for contrast, you know, there's about a 39% difference in calcium requirements in late gestation between a mature and a yearling ewe. Those yearling ewes cannot be mismanaged in regards to their macro mineral requirements. So that's just another important component that, where feasible, we need to make sure that we tailor our management to those stages of production. And those yearling ewes definitely are in need of those higher quantities. Next slide, please. When we talk about the micro minerals, again, those are often expressed in milligrams instead of grams. And so you can see we have zinc, selenium, manganese, iron, copper, and cobalt requirements. And so Similarly, you can see that these increases, especially with these micro minerals from late gestation to early lactation, are pretty significant. We want to make sure that we provide adequate minerals, not just to avoid those clinical deficiencies or those wrecks that we would expect similar to white muscle disease or other just clinical deficiencies, but really we want to make sure that we supplement that ewe adequately early on. Certain minerals are transferred across the placenta and accumulate in that fetal tissue that grows. Also, it was excellent talking points today, the importance of colostrum also, not only from an immune perspective, giving those protective antibodies, but also it's a trace mineral cocktail essentially, and it's concentrated in that colostrum sample, and it really provides those trace minerals necessary for that neonatal or newborn lamb. And so proper mineral management not only prevents deficiencies, but it really ensures that we program those lambs to go in the right direction in the weeks after birth. So as Dr. Ellison mentioned, I wanted to talk a little bit about pregnancy toxemia in ewes. And for me, again, it might be just the academic side, but I think it's important to understand why. Why are those ewes predisposed to these metabolic issues in late pregnancy? And I think the operative principle here for us to understand is that ewe in that last third of pregnancy, in those last 4 weeks leading up to birth, those fetuses grow rapidly. That graph right there, you can see at the day 120 of pregnancy, we just see a dramatic increase in the weight of the fetuses growing inside that lamb or that ewe. And so she has to produce a tremendous amount of glucose, okay? Not only from the diet does she get that, but she has to produce it in the liver. And oftentimes she has to pull, in addition to producing that glucose, she has to pull fat off of her system to produce those energy metabolites to provide enough glucose. And so really it's similar to an engine where we have to make sure that we change the oil accordingly, but that we provide that fuel. One of the things that I think is grossly misinterpreted across the board is that we assume that ewe can pull fat in an indiscriminate amount so that she can do all she wants. As long as she's got back fat, she'll be fine. Well, that's not true. We know from understanding metabolism that you need energy to fuel that pump, so that pump can fuel and pull off those fatty acids and produce, energy for that ewe. And so it's really important that we make sure that we provide that adequate energy just so that she can use those adequate body reserves that she has accumulated over time. Now, pregnancy toxemia, I don't want to sugarcoat this. This is one of those situations where prevention is much more effective than us trying to pull this ewe out of these symptoms. Mild cases, and we have to catch them very early. And I think a good rule of thumb to say whether you've caught it early or you're too late is if the ewe is still on her sternum or she's starting to exhibit some, oftentimes they begin to lose a little bit of coordination and they bump into objects as some of their eyesight is temporarily inhibited. And so those are the early stages. If she is on her side and she's kicking, we have all unfortunately seen enough of those cases where we know we may be a bit too far behind. But I put this propylene glycol on this slide just so that we are prepared. We have those things in our toolbox that we can drench orally. Generally speaking, about 100 mils per day is what we're looking for. We do not want to do that all in one shot down her mouth. That amount of sugar can cause some digestive upset, so we want to make sure that we break that out. But I think we also have to temper our expectations in that we don't give one drench of propylene glycol and that ewe is up in a couple of hours. Unfortunately, the instances that I've experienced with pregnancy toxemia and those who I've worked with producers on, it requires this intervention sometimes up to a week with not necessarily the most favorable outcomes. It's been mentioned that as long as she does have those fetuses in her and she's that far behind and she's recumbent or she's laid out, that inducing labor, whether it be through artificial means with those glucocorticoids or dexamethasone, or more invasive procedures may be necessary. But I think that's where consulting with your veterinarian, but more importantly, being on top of identifying those early symptoms where you may see a ewe staggering in the pen or losing some of her coordination. It doesn't always point to that, but having that on our radar in the last 3 weeks leading up to lambing is just good best management practices. Next slide. I think risk factors, who you should be keeping an eye on. These don't include all of them, but I think what's really important is that we recognize those ewes. If we are in a flock with a heavy lambing percentage, so a large proportion of our flock is giving us twins and triplets, we need to identify those older ewes carrying that amount of lambs, that they are more predisposed to it. Older ewes, I assume that there's a distribution of ages of producers on this. I know my metabolism isn't what it once was, and especially gestational metabolism in older ewes is just not as functional as it once was in their prime years. And so older ewes are going to be at risk. High milk producing breeds can also be at risk, not only for pregnancy toxemia, but milk fever. And then body condition score, and I have a typo on this. It's not just those ewes in poor condition, and this is something to keep in mind. We oftentimes think that fat ewes are just always eating and they're doing a ton of consumption of the feed that we have. Well, there's hormones produced in the fat cells that tell that ewe not to eat as much, believe it or not, even though she's already pretty large, that actually suppress appetite. And it's that suppression of appetite, again, talking about the fueling of that metabolism so that she can pull fat off. If they're not consuming enough, she may also be predisposed. So it's also overconditioned ewes can be at risk for pregnancy toxemia. And again, it's all about timing. And I think this is where, as we transition and think about how our management changes, and there's been a lot of talk of that earlier today, we don't want to wait until we get to 3 weeks out before we start saying, man, I wonder if I'm feeding enough. This decision, whether it be testing a feed, making sure that our delivery of feed and the schedule in which we deliver feed, those are all things that need to be looked at closely, especially those last 3 weeks. You know, I had an incident last year where a producer called and he had 2 older ewes go down. This wasn't a large producer, but it was in a shed lambing system. And we tried to talk about, well, what did we do different? We knew we were dealing with pregnancy toxemia, but he did mention after the fact, he said, you know, I had some issues with equipment earlier in the morning and I didn't get those ewes fed till about 3 hours after normal. And we don't have concrete evidence to say that was the case, but it does allude to the fact that we need to make sure that our scheduling, our timing, much like Josh mentioned earlier, is in line this last third of pregnancy, because this is where we begin to see issues. Next slide. I throw this up there. This is just a study that looked at subclinical pregnancy toxemia. So clinical pregnancy toxemia, those ewes are recumbent, they can't stand up, it's a bad situation. But this study looked at what happened when we weren't feeding those ewes to the optimum and they were subclinically toxemic. And so basically what this shows is the healthy ewes after an immune challenge study exhibited a much stronger immune response post-lambing than those ewes that perhaps had been in poor condition or hadn't been managed to maintain adequate glucose levels in their system. And so I think this speaks to, we've done a lot of work with mastitis and these other animal health issues that may present themselves the weeks post-lambing. I think this just speaks to the importance that we make sure our nutritional program is in sync so that we can avoid some of these other issues that are related to previous nutritional management of the ewe. Next slide. Hypocalcemia. Now, this is often referred to as milk fever. There's an excellent resource that I'll point to right off the bat from Premier One that gives you some quick tests to look at whether you're dealing with pregnancy toxemia or milk fever. I haven't tried this yet, but it looks at covering the eye using your flashlight on your phone and watching how slowly that eye constricts. Generally speaking, it was recommended that the slower the constriction of the eye may point to milk fever, and if it constricts pretty fastly, it may be pregnancy toxemia. Again, I haven't used this, but I think it is really important that we differentiate milk fever in sheep versus cattle. Because of the skeletal growth and just how much pounds of lamb grow inside those ewes, the calcium demand that we see in a ewe is very different than the calcium demand we see in lactation of a cow. And so it's for that reason that we oftentimes see milk fever presented at a similar time point of pregnancy toxemia before lambing. This is similar paralysis of the smooth and striated muscles. So we just see, what we see is that ewe unable to rise, okay? Obviously in real time, it's really hard for us to get blood calcium levels. But we also know that these low calcium levels can also further drive down blood glucose, which again was the driver from the previous metabolic issue that we talked about. So I think it's really important if you're feeding a lot of cereal hays, low quality forage maybe is a major component of your diet. If it's a TMR or corn silage, we just need to make sure that in that second part of pregnancy, that we make sure that those calcium levels are adequate. I think the success rate with milk fever is much better than pregnancy toxemia. And again, I took a picture of this calcium gluconate solution, this 23% solution. Generally speaking, it's about 60 mils. Given the volume of that injection, we recommend moving those and separating those injection sites so that we can have adequate absorption. But generally speaking, the response is pretty quick. And so I would recommend that you all have that on hand as well. And again, please keep in mind that milk fever doesn't, in sheep, presents itself in many cases prior to lambing. Next slide. I think a theme that we had today, which I think was timely, and believe it or not, we didn't sync it, but it really is all about prevention, whether it's the planning of our resources to fit in with our lifestyles and the lambing cameras, to our setups in the lambing pens for hygienic and reduction of pathogen transfer to those lambs, nutrition, whatever it is. Prevention is just a best management practice. And I think it really requires some sound planning in advance of these things. As Josh mentioned, we all have side gigs, we work, we have families. And I think just strategic planning allows us to make sure that we don't have to be reactive in the crisis. Because I think all of us can agree that sheep production is a lot less fun when we're just putting out fires. I enjoy it when it's working the way it should. And so with that, I think we can take some questions. That was the last slide. And I'll turn it back over to the moderators.
Thank you, Melinda and Whit. That was really good, very informative. A lot of information to think about and be reminded of too, even if we knew some of it. So we have a pretty good amount of questions. I think the way we're going to move forward from here is we'll have about 15 minutes worth of questions. And if we're not able to answer some of those within the 15 minutes, we'll try to get some of our hosts and presenters to answer them in the text, but we'll start working through them as much as we can now. So I think the first question that I'm gonna move over to is a question that I'll give to, oh, looks like someone might have answered it already. So one question, a kind of a two-part question with someone talked about their experience with some tendon tears, some prepubic tendon tears, and they were informed that they may need to look at it as a copper deficiency. And up until that time, they were told to avoid any copper in the sheep diet, except this year when they provided a Purina tub with copper available for sheep. They had no instances of prepubic tendon tears. And similar question as someone said, well, I thought we were not able to give copper to sheep. And so what do you say to that?
Okay, so I can't speak to the prepubic tendon tears as it relates to copper. I think sometimes us diagnosing things in retrospect, although that would make us really awesome, I don't feel comfortable doing that. I will say that sheep do have a copper requirement. And I think there is a narrative that that sheep don't. And the truth is that that very sensitive range of requirement to toxicity is very little. So about 9 parts per million, generally speaking, 9 to 12 is kind of that recommended level. And total daily copper intake is on a dietary basis. Certain breeds can tolerate more copper than others. So some of our Texel and our breeds from the Netherlands perhaps are considered the more susceptible to copper toxicity. Some of our black-faced terminal sires are intermediate, and then our white-faced breeds are probably some of the lesser susceptible to copper. But we've done a lot of work on winter range in our state, looking at sheep that consume a majority of their nutrients from dormant grasses and shrubs. And we've determined that there is a small copper deficiency. And it really requires some precision formulation on the feed manufacturer side so that they can account for that margin of error if a ewe did consume a bunch of mineral. But yes, sheep do have a copper requirement. I think it's a headache for for feed manufacturers that have to deal with regulative burdens to make sure that they don't exceed those thresholds. And sometimes I think it gets mistranslated into that sheep don't have a copper requirement when they do.
Okay, thank you, Whit. I'm gonna direct the next question to Melinda. I think you covered some of the body condition scoring. Someone has a group of rescued ewes who are very down in body condition. So what are some things that she can do to help them with current lambs on them?
That's a great question. And it's one of those that unfortunately sometimes we get into those positions, right? And it certainly could be both lack of nutritional driven, or it may also have something to do with parasitism. So I would start by maybe having fecal egg counts with your local vet to determine what their parasite load is, because if you can start with a good treatment for that, it will help. Also, we can work a diet where you're just dumping some really good energy and protein to these ewes, which will help increase their milk production. It is going to be expensive at this point because it's just taking so much extra for them to meet those. But there are feeds out there that you can really get that supplementation to the animals. The other thing with the lambs is if the ewes are struggling to make enough milk, it's probably worth getting them on some milk supplement. So provide them with colostrum in the beginning. There's powdered colostrum that you can purchase for lambs. You can also supplement with milk replacer. Usually if a lamb is on its mother and eating its mother's milk, if they're getting enough, they won't take the supplement, but if they're not getting enough, they will. So you can gauge it that way. That's a good way to understand if your lambs are getting what they need. The other thing would be to get them started on that creep feed. And while that's not going to kick in for the first 2 to 3 weeks, once it does, it will help them immensely to get the nutritional requirements that they need. So those are a few options, and certainly feel free to reach out to me if you want me to help you with the high quality supplements for your ewes at this point. So
Great. So we have a question more specific to goats, and maybe Carmen, you can chime in on this a little bit, but does pregnancy toxemia also affect goats? And then maybe you can also kind of point out some ways to treat that.
It does affect goats. And I believe it's a similar treatment as what it would be for a ewe. I know I've had experience with ketosis, and we use the same propylene glycol. And yeah, it's hard because sometimes, especially with dairy animals, dairy goats specifically, they can have a hard time with that when they have multiples, and then they have those signals to produce a lot of milk and take those stores out of body storage. And so yes, it can also happen to them. The treatment is the same, but definitely consult with your veterinarian on individual treatment for your animal.
Great. I think we'll take 2 more questions. There's still a couple left. If any of our hosts would like to try to answer some of these questions with text, that would be great too. There are quite a few questions that are still revolving around minerals. So I think in order to answer some of these, it might be appropriate just to talk about whether or not a mineral analysis comes with our feed analysis. And then also, what are some things we can do to supplement mineral to our animals? And I'll kind of leave that open, Melinda or Carmen, or even Brett.
So the question about the feed analysis, usually the standard hay analysis from a feed company will come with some of the minerals. So you would get like calcium, phosphorus, potassium, manganese. You would have to request to get the rest of them. So the micro minerals are usually not included. Supplementation, there's a number of ways you can go about this. Obviously, if it's a matter of supplement or not, go to your local feed store and pick up a sheep and sheep specific for sheep and a goat specific for goats mineral to feed them. You can also buy them online. I know Premier One sells a bunch of different types of minerals that are specific to different stages of production. And the other option would be to have some feeds tested, test your water, get some good ideas about where you are from a nutritional standpoint, and then work with a mineral company to develop something specific to your operation or the area that you live in. Maybe you have neighbors that would go in with you on that, but usually feed companies are willing to mix mineral packages specific to your needs.
Great. And we'll end with one last one. And anyone can kind of take this. So as far as trying to encourage bonding between a doe and its kid, or maybe a ewe and a lamb, at what point do you kind of decide to stop and pull the lamb or the kid?
So I had started typing an answer to this, so I'll just kind of
Okay.
read it out, and then you guys can, interject if you want. So I kind of put this in two categories. There's the doe that doesn't want the kid to nurse, and she just kicks it and pushes it away and things like that. For that situation, I usually will tie them up or just kind of help that kid get latched on. And sometimes that doe just needs to understand, like, especially if their udder is really tight, it's very uncomfortable, and they almost don't want nursing because it's painful when they first start. So you just have to get that attachment going, get that kid on to nurse some of the milk out. Sometimes just get some of the milk out so that they aren't so uncomfortable. And then there's the other side where the doe can be really aggressive toward a kid, and to the point where they're pushing them away, headbutting them, knocking them into the fence, just being really aggressive. And in that situation, I have not been successful in getting them to take that kid on. It's hormones, it's pheromones. There's just a lot going on that it's hard to overcome that type of response. Whereas sometimes if it's just they're a little unsure, they don't know what's going on, if you can get the kid on a few times to nurse, usually they'll start bonding after that.
Okay, well, we're gonna wrap things up. I just want to remind any of you that you're free to reach out to any of us. Feel free to contact us anytime if you have any kind of questions, or we can help you with anything at all.